Good morning. We're so glad and happy that you're joining us today for this live webinar on lifestyle medicine, the big picture. I'm Janine Kolko. I'm one of the educators here in the Mayo Clinic Cancer Education Program in Rochester, Minnesota. My colleague, Angela Murad, who also is a patient educator in the Cancer Education Program, is also joining us as a co-host for this session. Maybe wave, Angie. Thank you. We want people to know that this session is being recorded so that individuals who are not able to join us for the live session can watch it at a later date. It typically takes a day or two to have that recording edited and placed onto our video library on the Cancer Education page on Mayo Clinic Connect. We really encourage you to like and follow the Cancer Education blog on Mayo Clinic Connect so you can really stay up to date on the upcoming webinars and other educational opportunities. Angie will put the link to that Mayo Clinic Connect for our page out on the chat box. Some upcoming webinar sessions that we have also this month are Get the Skinny on Your Skin and Skin Cancer by Dr. Jerry Brewer, a Mayo Clinic dermatologist. Revitalize Your Well-Being, Living Well During and After Breast Cancer by Dr. Dawn Musalem. She's a Mayo Clinic medical oncologist from the Florida campus. And then meal planning, making it manageable by Angela Murad, our educator, and also she is a registered dietitian. We will allow time for question and answers at the end of the presentation today. You can type your questions in the chat box function, and we will do our very best to have your questions answered as our time allows at the end of the session. Now, it's my pleasure to introduce our speaker for today's session, Dr. Hensrud. He's a Mayo Clinic consultant with the Division of Internal Medicine, the Division of Endocrinology, Diabetes, Metabolism, and Nutrition. He's also with the Division of Preventative, Occupational, and Aerospace Medicine, and with the Mayo Clinic Executive Health Program. He is also the director of the Mayo Clinic Healthy Living Program. He's a very busy gentleman, and we're very happy to have him here speaking for us today. Dr. Hensrud's research interests focus on the areas of obesity, nutrition and disease prevention, physical activity, and health promotion. He has authored numerous publications on health, wellness, and disease prevention, as well as several books, including the Mayo Clinic Diet, the Mayo Clinic Diabetes Diet, Mayo Clinic Cookbook, and Mayo Clinic Book on Healthy Weight. Please join me in welcoming Dr. Donald Hensrud. Thank you.
Thank you very much, Janine. It's a pleasure to be here. And I'm going to talk about lifestyle medicine. I know this is a cancer course, cancer orientation. I will include information on cancer, but I'm also going to broaden it out a little bit, incorporate some things that we can do to improve our overall health as well as prevent cancer. I have no disclosures. And what I'm going to do today is provide examples of the powerful relationship between chronic disease and lifestyle habits. And I'm going to focus a lot on diet and nutrition and somewhat on physical activity. Angie's talk later on how to implement dietary changes will fit right in with this. People intuitively get this, that diet and nutrition and physical activity and managing weight, they're important. I'm not sure people realize how important that they can be in preventing disease and improving health. And I'm not sure they realize that it doesn't have to be drudgery. It can be something that we all can do. We're not aiming for perfection, but we're trying to improve our health a few steps along the way. So let's start out and we'll talk about the leading causes of death in the United States. This is some of the latest data, and many people are aware that heart disease and cancer are the two leading causes of death. They have been for quite some time. The prevalence is decreasing a little bit, but overall, if we want to focus our efforts on improving health and living longer, we should look at the risk factors for those conditions. Over half of the leading causes of death are related to diet and nutrition, over half to physical activity, over half to smoking, and over half to increased weight. So lifestyle plays a powerful impact, has a powerful impact on what people are dying from. Let's talk about heart disease first. This is a study that was published some time ago, and it estimated what percentage of heart disease, cardiovascular events, would be prevented if all women didn't smoke, ate a healthy diet, exercised, had a normal BMI or weight, and used alcohol moderately. There have been many studies like this in men and women. I chose this one in women, and they're all pretty consistent. So think about, if you have any guesses yourself, what percentage of heart disease is at least theoretically preventable if we all had optimal heart health? And the answer, 83%. So pretty powerful impact. This study went on to estimate how many women actually did these things: didn't smoke, ate a healthy diet, exercise, weren't overweight, and used alcohol moderately. And any guesses, or can you think of what percentage of women and men are able to do this? 3%. So what this shows is that this isn't neurosurgery. These aren't complicated things. They're very straightforward, but they're hard to do in our everyday lives. We've got a lot of challenges to implement these things. On the other hand, if we can implement them, the return on investment in preventing heart disease and other conditions is tremendous. These types of studies, as I said, have been done in men and women around the world and in the United States. Among African Americans, this figure here of optimal heart health is only 0.5%. So that's why the American Heart Association, they've had numerous guidelines over the years. The most recent ones are the Simple 7. Manage blood pressure, control cholesterol, reduce blood sugar, and decrease the risk of diabetes. Get active, eat better, lose weight, stop smoking. Again, very straightforward. They want to simplify the message so it gets to more people. This shows what we're trying to prevent. This is from an autopsy study. It's an artery in the heart. There are 3 main ones. They cut it in half, and we're looking at the artery head on. So this is where the blood used to flow, or this is where the blood flows now. This is where the blood used to flow. So when you hear that somebody has a 50% blockage in an artery in the heart, this is about 50% here. The more risk factors people have for heart disease, the more likely they are to have this plaque build up over time and suffer a heart attack when either a blood clot forms or this plaque fills up the artery. It's important to note that a stress test, we do stress tests to make sure somebody doesn't have critical heart disease, doesn't become positive until this narrowing is about 70% or so. That's why prevention is so important. So let's switch now to cancer. Over half of cancers are potentially preventable, and many people are familiar with the impact of smoking on different cancers, particularly lung cancer. Up to almost a third of cancer deaths are due to tobacco. What many people aren't as aware of, though, is that about a third of cancers are due to suboptimal diet, physical activity, and weight factors. So again, lifestyle can play a huge role in many different cancers. We used to think it was just a few cancers. Now we know that many of them are related to lifestyle factors such as these. To illustrate that, even in the United States, there are variability in the cancer rates in different states. This shows colon cancer here, lung cancer here, in Kentucky men and women, and Utah men and women for both colon cancer and lung cancer. As you can see, men and women in Utah have a lower death rate from colon cancer and from lung cancer in Utah compared to Kentucky. The reason for this isn't because of genetics, it's because of environmental influences. Obviously, in Kentucky, a tobacco state, more people smoke. In Utah, people are a little bit more health conscious and don't smoke. They also carry a lower weight and may
We somehow lost your audio. Yeah, it was just fine, and then all of a sudden just quit.
No.
There. Yep.
Okay, we're going to dispense with the headsets here.
Maybe just a little louder, if you can speak.
So this shows the impact of diet on cancer, fruits and vegetables specifically. This is from the World Cancer Research Fund. They published a couple of big monographs. Now they're online, and you can look at them online to see the latest data on cancer risks. They literally reviewed all of the studies on diet and nutrition and cancer. And these are some of their findings of different fruits and vegetables and decreased risk of various cancers. What you can see here is the wide variety of cancers that are protective from fruits and vegetables. And I want to particularly note that it says foods that contain folate, foods that contain carotenoids. It's not necessarily the individual nutrients, and we know this from supplement studies, that supplements do not provide very much benefit in decreasing the risk of cancer. But foods that contain literally hundreds of different nutrients provide benefit in decreasing the risk of cancer. This is some data on meat and colorectal cancer. This was a meta-analysis where they take a whole bunch of studies, 21 of them, and they put them together so there's a lot more power to detect associations. For each 4 ounces of red meat that people consume, the risk of colorectal cancer increases by 17%, and each 2 ounces of processed meat per day, the risk of colorectal cancer increases by 18%. Based on this, the World Health Organization, a few years ago, they raised some eyebrows and they said that based on the available evidence, red meat is a probable carcinogen and processed meat is a carcinogen. Now, they didn't just come up with this all of a sudden. This data has been accumulating for a number of years, and they finally said there's enough evidence that we feel comfortable making this association. This data doesn't mean that everyone should become vegetarians. On the other hand, if people want to decrease their meat consumption, that certainly will improve health. So there's different ways of dealing with this. One is the 90-10 rule. It's what you eat 90% of the time that counts. Another way of doing this is the quality-quantity rule. There's some foods you eat for quantity, and I'll come to fruits and vegetables again in a little bit. A lot of fresh or frozen fruits and vegetables is good. Other foods that have higher calories or have different, not quite as healthful, you may want to go for quality instead of quantity. So for red meat, cheese, chocolate, other goodies and sweets, ice cream, go for quality and have a small amount, enjoy it, and then stay on your old program overall. So these are data from the American Cancer Society. And again, they're very consistent with other guidelines. Over the years, we've seen a convergence of guidelines to promote health from the American Heart Association, the American Cancer Society, and other groups. Achieve and maintain a healthy weight throughout life, be physically active, 150 to 300 minutes of moderate, or 75 to 150 minutes of vigorous physical activity per week. Children an hour a day, limit sedentary behavior. We'll come back to that when I bring up some things on physical activity, and follow a healthy eating pattern. Variety of vegetables, fruits, and whole grains. Limit red and processed meats, and you saw one of the studies that is behind this. Limit sugar-sweetened beverages and highly processed foods. And they came out and said it's best not to drink alcohol. The data on alcohol changed a little bit, and they differ between heart disease and cancer. Most cancers are promoted, not most, many cancers are promoted by alcohol. Heart disease, there may be some benefit with moderate consumption, especially as people age. So that was heart disease and cancer. Let's talk about diabetes. This shows how diabetes has increased in the United States. In 1960, only 1% of the population had diabetes. The latest figures show 9.3% of the population has diabetes, and a fourth of people don't even know it. So what could be driving this? Well, we also know that in the early 1970s, weight started to go up in this country. We'll come back to that later. After a lag period of some years, about a decade or so, diabetes started to go up. And this is probably due to the increased weight that people have gained over the years in the United States. Weight is the strongest factor to increase the risk of diabetes. And this is data that shows that. This is low normal body weight, high normal. So even within the normal body weight category, there is some change in risk. Overweight, mild obesity, and greater than mild obesity. And you can see the powerful effect that weight has on the prevalent on the incidence of diabetes. So what can we do about that? Well, this is one of the best lifestyle trials around, the Diabetes Prevention Program. It was started a number of years ago, and they had people change their physical activity and their dietary habits. The goal was to lose weight, about 7% of their weight or so, and they did a good job in working toward that. They compared a control group, a placebo group, with a medication, metformin, that will lower blood glucose and also leads to a little bit of weight loss, compared with lifestyle changes that emphasize diet and physical activity to lose weight. This shows how many people develop diabetes over the 4-year study period. Compared with the control group, metformin group decreased the risk of developing diabetes. The lifestyle group, who lost some weight, decreased it even further, twice as much as the medication. And this is one of the strongest studies. It was a randomized trial that showed that managing weight, changing lifestyle habits will reduce the risk of diabetes over time. What was particularly interesting about this study is they kept following people for a number of years. The trial ended here at about 4 years, but they kept following people out to 10 years. And even though they didn't have them continue in the trial and continue to work on these things, the effect of what they did, the lifestyle changes in particular, helped decrease the risk of diabetes for up to 10 years later. So this is, again, is powerful evidence in a randomized controlled trial that making lifestyle changes will help improve our long-term health and specifically prevent diabetes. Some people say, well, if I get the big one and go, I'm destined to do that sometime, but I don't want my biggest resource to go, my mind. So if you look in the literature, maintaining cognitive function and reducing the risk of Alzheimer's disease has been associated with increased physical activity, dietary patterns, and cognitive training. The brain is like a muscle. If you don't use it, you lose it, and training your mind and staying engaged can help prevent cognitive decline. Of these, the strongest factor was physical activity. So staying active increases blood flow, and it keeps our mind gives our mind the oxygen and nutrients it needs. We tend to get caught up in labeling diets. So people are generally familiar with the Mediterranean diet. The MIND diet is a combination of the Mediterranean diet and the DASH diet, which has been prescribed for hypertension, and a lot of studies have been done on that. So they took combinations of the Mediterranean diet, the DASH diet, they put it into a MIND diet, and they saw how many people developed cognitive decline or Alzheimer's disease when they followed this healthy dietary pattern compared to not following it. They gave people a score as to how closely they followed it. And they found that people who followed this pattern had a reduced risk of cognitive decline and Alzheimer's disease. There's nothing complicated about this, and people get too lost in the details and the weeds sometimes on diet and nutrition. The MIND diet is a plant-based diet, lots of berries, green leafy vegetables, nuts, fish. Many dietary patterns have this: the Mediterranean diet, the MIND diet, the DASH diet that I mentioned for hypertension, a vegetarian diet, or the Mayo Clinic diet. The similarities are much greater than the differences. So we shouldn't focus on the details and get lost in the details. The bottom line on nutrition is try and eat minimally processed foods with a variety of plant sources primarily: fruits, vegetables, whole grains, nuts, beans, and heart-healthy fats like olive oil. That summarizes nutrition there. This is a study that put it all together. It was 20,000 people in the United Kingdom. They looked at 4 behaviors: not smoking, moderate alcohol intake, being physically active, and eating the proverbial 5 servings of fruits and vegetables a day. The people who followed these 4 patterns could expect to live 14 years longer compared to people who didn't have these habits. And I'd argue it's not just the length of life, but it's the quality of life as well. So you can look at the 5 keys to wellness here, and you can categorize this in different ways. This is one categorization that we used in the Healthy Living Program: healthy diet, physical activity. I'm going to talk a lot more about those now. Resiliency is a mind-body area. It's our ability to manage and grow from life's challenges. The common denominator is that, but there are many different ways of doing it. Meditation, Tai Chi, stress management, even getting adequate sleep will increase our resiliency. So there's many different ways of doing that. I'm not going to focus on that now. I don't have time, but I'm sure you've heard other talks and there are other programs on resiliency. I'm also not going to focus on smoking or alcohol use, but I'll mainly talk about diet and also physical activity. There'll be some subliminal messages here as we go along also. So this is a question and I'm playing guess what I'm thinking. You can come up with your own answers here. All of the following foods and drinks have what in common? Vegetables and fruits, whole grains, nuts, fish, olive oil, coffee, and moderate alcohol. And you could say, well, olive oil could be the Mediterranean diet or antioxidants, and you'd all be right. What I'm looking for is they've all been associated with decreased total mortality. That means living longer. Now, many of these studies on these have been from population studies, not randomized trials, which has the best evidence. Population studies can't prove cause and effect, but when the data are consistent, it provides powerful evidence. It's hard to do randomized trials with vegetables and fruits and randomize 1,000 people to eat them for 10 years and 1,000 people not to. So we have to rely on other types of evidence. Conversely, red and processed meat's been associated with increased total mortality, shortens lifespan. It's not a lot, but it is statistically significant. It's not as much as smoking, for example. And I'm not trying to turn people into vegetarians, but I'm not trying to ignore the data that exists. The data are what the data are. So let's look at just some individual studies here. Excuse me. This shows with increasing intake of fruits and vegetables a day, these are the people who ate the highest amount of fruits and vegetables, over 6 servings a day, the risk of dying, all-cause mortality, decreased by up to 26%. Whole grains and mortality showed similar relationships. Excuse me. And this is for all-cause mortality, cancer mortality, and heart disease mortality. So dying from these 2 conditions and overall dying decreased with increasing servings of whole grains. A whole grain being whole wheat bread, whole grain bread, anything with whole first, brown rice, or oatmeal are examples. To give you an idea about how much this is in grams per day, a slice of whole wheat bread is about 30 grams. So just consuming a couple servings per day of whole grains will decrease the risk of dying. Again, we can't prove cause and effect, but this is strong data that this effect exists. Again, I apologize. This shows data on nuts and mortality in 2 large studies. And again, servings per week. A serving isn't that big of nuts. A serving is only about a small handful, perhaps a half an ounce of nuts. So it isn't that much. And again, the relationship shows with all-cause cancer and cardiovascular disease mortality. And people who ate 4 servings a week had a decreased risk of dying from heart disease, cancer, and overall mortality. Same thing with fish. This is a study out of China that people who ate more fish servings per week had a lower risk of dying overall. And here's some of the data on meat with increased consumption of red and processed meat there's an increased risk of dying overall. Again, the risk is not that great, but it is statistically significant. And this is a very large study that looked at different foods and mortality. Some of the ones we've talked about: whole grain bread, oats, root vegetables, green leafy vegetables. Anything less than 1 here suggests a protective effect against dying. You can see that all of these foods, the ones we've been talking about, have a protective effect, except for red and processed meat. So I like to give a little bit of a talk about coffee, because there's a lot of misconceptions about coffee. People come into my office and they say, "Doc, I'm drinking too much coffee." And I'll say, "Why?" "Well, it isn't good for you." Let's take a look at that. Coffee has been associated with a decreased risk of type 2 diabetes, Parkinson's disease, liver disease and liver cancer, improved mood and decreased risk of depression, possibly gallstones and kidney stones, certain cancers, and overall mortality, as we've already talked about. So the health effects of coffee are pretty good. Now, again, the amount that it decreases these diseases is not that much compared to other habits, such as body weight and type 2 diabetes, for example, but it is statistically significant. The one area that you need to be careful of with coffee is pregnancy. A small amount of caffeine may be okay, but with increasing amounts of coffee or caffeine, there's an increased risk of miscarriage and, interestingly, childhood acute leukemia from maternal consumption of coffee. The problem with coffee is not the health effects, it's the side effects. And some people are more susceptible than others to the side effects. Withdrawal headaches, it's mildly addictive. Insomnia, heartburn, stomach upset, urinary symptoms, particularly in older men, for example, who already have some urinary symptoms, palpitations. If people are not having side effects from coffee, I have a tough time to recommend they cut down. The data on some of the conditions, such as diabetes, show a protective effect up to 5 to 6 cups per day. But again, if somebody's having side effects, then they should cut down. The other issue is what you add to your coffee. It's been estimated in some coffee drinks, the amount of sugar and cream and milk can increase the calories by up to 500 calories in one drink. So if you're managing your weight, try and watch what you put in your coffee. And speaking of weight, let's talk a little bit about obesity in the United States. This is obesity in the 1990s. No state had a prevalence of obesity of 15% or more. If we fast forward just 1 decade, the prevalence, all states had 15% or more, and many had 20% or more. Another decade, all states were 20% or more, and some were 30%. And the latest data from 2018 show many states are getting greater than 35% prevalence of obesity. So this is over a very relatively short time period. Many people have said, well, it must be the environment. And there are changes in the environment. But the best way to look at this, it's environmental changes on top of a permissive genetic predisposition. It's been estimated that about 30 to 40% of weight is related to our genetics, and the rest is related to environment. So it's a combination of things. It isn't only the environment. And this just illustrates some of the things that have happened in the environment. This is some marketing here. You can get a burrito as big as your head. I'm not sure why someone would want that, but that apparently sells burritos. Here's the supersize phenomena. Calories are cheap when you serve large portions. We've engineered physical activity out of our day. There's more computers and games. And this one kind of speaks for itself. Here, we're more kind to our pets and our cars than we are to our own health. Let's switch gears a little bit and talk about what we can do about it. The Mayo Clinic Diet is based on a concept called energy density or calorie density. If you think about what determines how much we eat, it isn't calories. You don't say I've had 500 calories and now I'm full. It's the volume or weight of food that you consume that determines satiety and how many calories you get. Some foods have a lot of calories in a small volume. Other foods are bulkier and may fill us up faster at a smaller calorie amount. The easiest way to illustrate this is with pictures. So all of these foods are 1,200 calories. This is 1,200 calories from butter, 1,200 from hamburger, 1,200 from sugar. There's no fat at all in sugar, but it's very calorie dense. And you can get in a lot of calories without realizing it by eating foods that are high in added sugars. Raisins are healthier than sugar, but they're still very energy dense. So what adds bulk and volume, but not calories? Water, fiber, and to a lesser extent, air, such as in popcorn. With popcorn, you start out with just a small amount of popcorn. If it were regular corn, you could eat it quickly, but you pop it up and it takes a lot longer to eat. Fruits and vegetables contain a lot of water and a lot of fiber. So for your 1,200 calories, if you added the water back to the raisins, here's 1,200 calories from grapes, 1,200 from strawberries, 1,200 from lettuce, and 1,200 from celery. Now I get it. Nobody is going to eat this amount of celery. But the point is, by eating more vegetables and fruits, you can actually, it sounds like a gimmick, but you can actually eat more food and get in less calories. And there is evidence to support this. This is a very large study, Nurses' Health Study and the Health Professionals Follow-Up Study. We tend to gain about 1 pound to 1.5 pounds a year in the United States each year. It's usually over the holidays, and it's usually cumulative. It stays on. So this study estimated how much weight gain every 4 years is due to specific foods. And you can see here, these are the foods that contribute to weight gain every 4 years. Not much, but it adds up, of course, in the population and with a full diet. These are the foods that contributed to weight loss. Vegetables, whole grains, fruits, nuts even. Nuts have gotten a bad rap because of their fat content, but you've already seen they can lead to improved health effects. They may help manage weight. When people are eating nuts, they don't eat other foods that are higher in calories because they feel satisfied from the nuts. Now, if you sit down with a pound of peanuts, all bets are off. And yogurt too. The beauty of this is the same foods that'll help to manage weight are the ones that we looked at earlier to improve health. So it's not either or. This type of dietary pattern can both improve health and help people manage weight. And that's the basis of the Mayo Clinic Diet. And I might mention that we just have come out with a new Mayo Clinic Diet online plan and app. We're partnering with a company from an international company from Australia, Digital Wellness, and they are helping us deliver the information. We're not changing the Mayo Clinic Diet. It's been around for over a decade. We think we have it right, but they're providing all kinds of tools and resources: food tracker, physical activity tracker, a habit optimizer to help with the lose it phase of the Mayo Clinic Diet, an online support group, and you'll see more about this. The Mayo Clinic Diet was just named the top dietary program in the United States by US News and World Report. So this just summarizes this. An optimal diet, and we've been talking about this, you've seen the studies and the data, is higher in vegetables, fruits, whole grains, lower non-fat dairy, seafood, beans, and nuts, moderate in alcohol, lower in red and processed meats, low in sugar sweetened foods and drinks, and refined grains. This is the Mayo Clinic Healthy Weight Pyramid. It's been around for over 20 years. We haven't changed it. We put fruits and vegetables on the bottom, and both for health and for weight. And you've seen the reasons why. We recommend all the fresh or frozen fruits and vegetables you want. It becomes a practical limit. There doesn't have to be just an artificial limit. You're not going to overdose on broccoli. In the other food groups, we recommend healthier choices: carbohydrates, lean sources of protein and dairy, heart healthy fats like nuts and olive oil. And the reason we put sweets here is nobody's perfect. Everybody needs a treat now and then. So let's plan for it. Let's eat the majority of our foods from the base of the pyramid, and everybody needs a treat. And daily physical activity at the center of the pyramid. The government has gone to a plate, and this is another good way to illustrate this: fruits, vegetables, grains, protein, and dairy. There's been changes in the way we look at different diets over the years. There have been fad diets, and some years ago, eating a low-fat diet was more popular. So I remember years ago, if you watched your fat intake, you could eat all the pasta you wanted. We turned that on its head, and more recently, keto has been popular, a high-fat, low-carbohydrate diet. So which is the best? This is data from different countries that show that maybe both of them are the best, and you don't have to go to the extremes that we have in the past. In Japan, in the 1950s, in this study, the average total fat intake in the diet was only 9%. They ate a very low-fat diet, and they had a low rate of heart disease. Crete is an island in Greece. And of course, in Greece, they ate a lot of olive oil. They still do. Mediterranean diet. They had a higher fat diet, but most of it came from olive oil, 25% of their calories, in fact. So they also had a low heart disease rate. The US and Finland had the same amount of total fat, but they had higher saturated fat because most of the fat came from meat in the United States and dairy products in Finland. They had a higher rate of heart disease. The point of this is you can eat either a low-fat diet, traditional diet, or a higher healthy fat diet and still have a low rate of heart disease and maintain health. But you don't have to go to quite the extremes that people are doing with keto and other real low-fat diets that may not be as healthy as a traditional diet. And these are some pyramids. This shows the traditional Mediterranean diet pyramid. Olive oil has its own category. Again, fruits and vegetables at the bottom, different types of grains, preferably whole grains, daily activity, wine in moderation, and meat as a condiment. Similarly, the traditional Asian diet, which is a lower fat diet, has different types of foods, but the principles still remain the same. The trick in all this is changing habits. And that's where many of us know how challenging it can be. We know what we're supposed to do, but it's hard to put it into practice. I don't think it has to be impossible, and I don't think it has to be drudgery. It starts with attitude. Many people come into my office and they say, oh, I've got to go on a diet, and it's almost punitive. There's great food out there. Many people say when I was eating better, when I was more active, when I weighed less, I felt better. And you can use that as an opportunity to explore new foods and embrace a healthy lifestyle. It doesn't have to be drudgery. I think people underestimate their ability to change. You can think of the things you've changed in your life and that you're doing now, that some foods that you didn't like when you were younger and now you like them. So change is going to occur. Before we make a change, it seems challenging. Can't imagine myself doing that. But after you make it, it becomes part of your routine, and then it's easier to continue. One example that I've given many times over the years is milk. Years ago, people drank whole milk, and when you talk to someone about drinking 2% or skim, their eyes glaze over and they say, oh, that tastes like water. I don't think I could do that. But then they get used to it and they go back to whole milk, and boy, whole milk tastes like cream. So don't underestimate your ability to change, but don't change things that you can't keep up long term. So start with baby steps when you make changes. I think it's possible to eat healthy and eat well. We've had some cookbooks in the past at Mayo Clinic. Our executive wellness chef at the Healthy Living Program, Jen Welper, has just come out with a brand new cookbook. We're very excited about that, and she's going to add to our ability to implement these changes. One of the keys is modifying old recipes and trying new ones. You don't have to give up some of the old foods that you enjoy. And if you try new ones, here's some criteria that you should consider. It should be practical. We can't spend hours in the kitchen every night. Taste good, fill you up, low in calories, and healthy. So what does that mean? An example that I've used is my wife and I got hooked on Greek salads years ago when we were traveling through Greece. And once a week, in fact, believe it or not, last night we had one, we'll have a Greek salad. And it fits these criteria. It's practical. When you get used to making something, I can make one for the entire family in about 10 minutes. It tastes good. I've got a big Jethro Bodine salad bowl at home. It fills me up. It's low in calories and it's healthy. So it fits all these criteria. Let's switch gears now. We're going to talk briefly about physical activity. You don't have to do what this guy did to get the benefits of physical activity. He ran 50 marathons in 50 days in 50 different states.
I think he's crazy. And actually, there's some data that may not be healthy. But just getting off the couch, you'll get the most bang for your buck. And this study illustrates that. This looked at sedentary time and mortality, dying, that is. Looked at 47 studies, and they quantified sedentary time, sitting, lying, or television watching. The important thing about this study is it controlled for physical activity. So these results applied to people who did exercise and those who didn't exercise. Increased sedentary time was associated with increased cancer mortality, cardiovascular mortality, all-cause mortality, and particularly it almost doubled the risk of diabetes. So it's important to be active. It's also important not to sit. Any activity is good activity, as we'll see in a minute. Here's the recommendations, and the American Heart Association and the American Cancer Society has adopted these. 150 minutes per week of moderate intensity activities, such as brisk walking, 75 of vigorous, such as jogging and running. To lose or maintain weight, there's something about it that we haven't quite figured out. We may need about 300 minutes of moderate intensity physical activity, but just walking is great. If people are going to exercise, I recommend they pick something they enjoy, or they're not going to keep it up. Perform it regularly. It's just as important or even more important than almost anything we do in our day in terms of our long-term health and well-being. And continue it indefinitely. As I've gotten older and as I've been working with patients throughout my career, I've realized that the weekend warrior mentality doesn't work well as we age. It's consistency over time, and that's challenging to do on a regular basis. When people are starting out, they should start out slow, baby steps, increase the frequency, how many times per week they do it, the duration, how long they do it, and the intensity, probably in that order. So start out slow, increase the number of times, how long you're doing it, and the intensity. Fitness can continue to improve for up to a year. The activities throughout the day are important also. And studies have been shown that people who are active throughout the day are much less likely to gain weight than people who aren't. Any activity is good activity. Take the long way around. Our inner brain tells us to eat a lot and do a little because that had a survival advantage years ago. We've got to outsmart our inner brain, our limbic brain, and look for opportunities to get activity. Avoid using children to do the tasks. Don't let them get all the benefits. My favorite is not only having a remote control, but asking a child to go get it for you. Walk whenever you can. And you're familiar with these things. Take the stairs, park farther away. I don't email my secretary when I can help it. I walk to her office and talk to her. It's not as efficient, but it gives me a little activity. And even airports, and the Minneapolis airport is an example of this. They've made it easy for people not to get a walk in with the moving walkways in an ideal time when it is easy to get one. Now, I realize some people need the carts because of disabilities, but most of us could get in a quick walk when we're walking through the airports. And activity monitors can help keep track of things. And when you track it, both diet and activity, you're more likely to be aware of it and to make changes. This is a study that I talk to people about that shows you don't have to reach your ideal body weight, and many people don't. In fact, most people do not reach their ideal body weight. This study looked at the Cooper Aerobics Center. They did treadmill tests on everybody who came through. They looked at the time on their treadmill test in terms of their fitness level. The top 20% were the most fit. And then they looked at body fat percent. And they followed these people over a number of years and looked at mortality. No surprise, at lean, normal, and obese body fat percents, the fit people had lower mortality. That is, they lived longer than people who weren't fit. But what's interesting here is people who were obese and fit had a lower mortality. They lived longer than people who were thin and unfit. And this suggests that even if you aren't able to reach your ideal body weight, which is challenging, just becoming more fit and active will help your long-term health. We have the Healthy Living Program, in addition to the Dan Abraham Healthy Living Center for employees over at the Dan Abraham Healthy Living Center. COVID has put a niche in our business, or a kibosh in our business, I should say. We still are offering lifestyle medicine consultations, that if somebody has a condition associated with lifestyle, such as high cholesterol, diabetes, high blood pressure, it is covered by insurance. We're doing those. We do physical activity assessments. We have a program for physicians that we're starting up again this year, and we're doing research on obesity. So think about the Healthy Living program if you're interested in taking this to the next level. We also have the Mayo Clinic Guide to Healthy Living, which is a self-administered program regarding healthy living that you can do yourself. The big picture here, the secret of life is enjoying the passage of time. They say in the end, it's the wink of an eye, and enjoy every sandwich. I've given away my taste in music here, but we still have to keep in mind the big picture, enjoy life and enjoy it fullest in a healthy, practical, and enjoyable manner that is possible to do. Thank you very much, and I'd be happy to take any questions that people have.
Thank you, Dr. Hensrud, for a wonderful and excellent presentation. And you know, the evidence is clear. Following a healthy lifestyle really helps with disease prevention. And it was just great overview and review, and it was excellent. So I encourage people to go ahead and put their questions for Dr. Hensrud in the chat function, and we'll take those questions.
Hi, this is Angie. I was just checking the chat. We'll wait a few minutes to see if people have questions, but I have one too. I was happy to see that there would be an app for the Mayo Clinic Diet. Do you know when that might be available? Like you said, when you track it, you just become more aware.
It's available right now.
Oh, okay.
If people, it's been a soft launch in December. We've been working with this company. And again, we haven't changed the fundamental aspects of the Mayo Clinic Diet, but the app and the online program that they're delivering is going to help us deliver it to a lot more people and give people tools and resources. So people could do a search on digital wellness, Mayo Clinic Diet, and they'll find it. We'll have different email blasts going out. And again, there's many for the tracking of food, for example. There's a database of over 1 million foods, many commercial foods people can enter in. There is psychological support. There's a habit optimizer in the Mayo Clinic Diet Lose It phase. It's a 2-week jumpstart phase where we throw the kitchen sink at people and they change 15 habits. The more habits that people change, the more weight they lose. And in this online program and app, there's a habit optimizer so people can keep track of that and see how they're doing. If people do that, they can expect to lose 6 to 10 pounds in the first 2 weeks. Importantly, it's all safe and healthy as well as effective.
No, that's great. Good to know on that. Yeah, I didn't know that was available. So no, that's good. Let me just make sure. I know people were excited about coffee being being something that they could continue.
I have a question for you, Dr. Hensrud. Yeah, I'm one of the coffee proponents. I was happy to see that's on the good list and not the bad list. You gave some information about processed meats being considered a carcinogen, and I was wondering if you could just give some examples of processed meats for people, just so we can maybe understand a little bit more of those things that we should try to limit in quantity.
Yeah, processed meat is anything that is cured, salted, smoked, or pickled. It often adds salt to it, but it changes the health effects, and salt is part of that. So luncheon meats, things like that, bacon are examples of that, hot dogs. And the degree of processing can vary. So there is some sliced roast beef, for example, that isn't processed very heavily, that probably doesn't have some of the as much of the adverse effects as other processed meat. And again, I want to emphasize it's a matter of amount too. So we're trying to help people be aware of these things so they can just be conscious and moderate their amount. We're not trying to get everybody to not enjoy life and not enjoy the foods that they really like.
Sure. So one I'm thinking of specifically that may fall in the processed meats that I tend to think of as maybe as healthy, but I'm not sure if it is just like chicken and turkey at the deli meat counter. I would think of that as a better choice than say ham or beef there in making a sandwich. So wondering if you could talk a little bit about the different types of luncheon meat, if there's gradients there or not.
Yeah, again, if it's just sliced and not much added salt, not much smoking that goes along with it.
Okay.
So the less of those types of things, then the less the detrimental health effects that go along with that.
Thank you.
You mentioned coffee. One more thing about coffee is caffeine is metabolized genetically. Some people are fast metabolizers of caffeine and other people are slow metabolizers. And so some people may be more susceptible to the effects of caffeine and coffee if they're slow metabolizers. So they may have to watch their intake a little bit more than people who are fast metabolizers. My wife is a fast metabolizer. She can go have a cup of coffee and go to bed. And if I have one in the late afternoon or evening, I'm up all night. So I'm a slow metabolizer. So again, that's another factor that may influence how people, how much people are susceptible to the side effects of coffee and caffeine.
Oh, that's interesting. I would have to say I'm a slow metabolizer too. No, we have a question. So one of our participants was asking, why do people often wait for kind of that moment in time when they see their doctor and they say they need to make this change? Or why don't they just kind of, this participant was saying they kind of have good habits in place, but why do people often kind of just wait until that moment when they're in the doctor's office and they kind of are, their backs against the wall, I guess you could say. I don't know.
That's a great question, and it gets down to human behavior and behavior change. And if I had the secret to that, I'd be nominating myself for the Nobel Prize. There are many things that give immediate gratification, things that are high in added sugars, treats. People vary in how much they like those, but they're things that give immediate gratification, but may not have good long-term effects. And oftentimes we default to that immediate gratification because it tastes good. It feels good for a short period of time, but we don't think about the long-term effects that may or may not occur. And we don't think about quality of life as much as we link with some of those things too. I alluded to this earlier, but a couple hundred years ago or thousands of years ago, the person who ate the most and did the least is the one who survived. And we think like that. I talked about this, but we've got to realize that that is not a survival mechanism these days. The environment has changed. So we have to look for opportunities to get activity and not necessarily gravitate toward only taste, but taste and healthfulness of foods. And it is possible to eat a good tasting, healthy diet, I think. When people see their risks outlined, when it's more graphic, when they look at their cholesterol, their blood pressure, or things like that, then it becomes more front of mind. But we should all try and realize that these things are occurring to varying degrees in all this all the time. And again, it's not just about living longer, it's about quality of life. And that's one of the most important things.
It also seems like we're so social too, and so many social activities with friends, family are surrounded by food. Yep. And not always the healthiest food. So I think good to help challenge our own friends and family systems to say, hey, let's have those social events and activities, but let's try to focus on a little bit healthier types of foods.
Yeah, and it doesn't have to be a wholesale change, just making some tweaks, and people can still enjoy things too.
Yeah, just thinking outside the box. Are there other things that we can do? Yeah, that don't always involve food necessarily. Yeah. One question, and I see Megan helped to put information about the Mayo Clinic Diet, but one participant was asking, please repeat what to search for the digital tool for the Mayo Diet. Yeah,
so we've had the book out for a long time. The book is available in all the bookstores around here, on Amazon.com, the Mayo Clinic Diet book. If you go online and search digital wellness, and Mayo Clinic Diet, their website will pop up and it'll show how to get enrolled in this program. I should say that there is a cost associated with this. There's a monthly fee, but the amount of information on there is tremendous. I believe, I'm not aware of a more comprehensive tool out there. People are familiar with many of the tracking tools and programs, but in terms of comprehensiveness and weight management, I believe this is the most comprehensive one out there. It's took our book and added to it a lot more tools and resources.
So I dropped the link into the chat, and I'll say if you go to that website and scroll down, you'll actually find Dr. Hensrud right on the site. So there's lots of good information there, but so go check that out.
Thanks, Megan.
Also, I wanted to point out that Angie posted a comment about the executive chef at the Healthy Living Program just very recently developed or made a cookbook called the Cook Smart Eat Well cookbook. That sounds pretty fascinating.
Yeah.
Jen,
Oh, go ahead, Dr. Hensrud.
I was going to say, Angie knows Janet, and Jen Welper is outstanding. She's been working at the Healthy Living Program for quite some time. She's given cooking classes. She's a true chef, and she really knows how to make food taste, healthy food taste good. And she's good at coming up with things that people can do, cutting and preparing for more than one meal, for example. Don't just prepare for one meal. So some step-saving activities. And I'm sure she incorporated that in her new cookbook too.
Yeah, I always loved how practical her approach is. I learned a lot from her, so it's been great. Yeah, I'm looking forward to getting her book. So good.
I think we're probably done with. I don't see any other questions that have come in, and we're coming up on the end of the hour. So I think this is a great time to thank you again for your time and expertise and sharing this excellent presentation with all of us, and we just appreciate it so greatly. Thank you.
Bon appetit to everyone, and I hope you have a good 2022.
Thank
Thank you,
so
Dr.
much.
Hensrud.